Hello class, I hope this finds you well. This is just a very short podcast to orient you to what we would have talked about had we had orientation this week. I'll do a quick course overview and talk a bit about the assessments, and I really won't talk about the activities and assignments. That's all in the course syllabus, so I will let you review that on your own time, and if you have questions, please don't hesitate to contact me. So this course, as I mentioned before, is different than all the other courses that you've taken so far. It's an experiential course, which means you get to see what it really feels like to be a pharmacist in the community. You'll be able to interact with other pharmacists and technicians and other healthcare professionals and start to adopt what it means to be a professional pharmacist. The course is built around the following outcomes, and if you go to your syllabus in Appendix 1, these are detailed for you. Under these 7 titles, and under each of the titles, there are a number of bullets. And these bullets are the behaviors that your preceptor will be assessing you on throughout your placement. So the different titles are professional, communicator, scholar, care provider, collaborator, manager leader, and advocate. So here is an example of one of the behaviors under professional. Acts professionally. Professionalism outcome number 1 displays professional behavior and adheres to high ethical standards. And underneath that outcome there are several bullets that helps to guide the preceptor and you as to what's expected from you on the placement. So then the preceptor will be rating you at midpoint and at final on a scale of exceeds acceptable level of performance, meets, needs improvement, or not meeting an acceptable level of performance. So as a student, it's not uncommon to receive a few needs improvement at midpoint. That's what's expected because you're learners and this is your first placement and these things are all new to you. If at your midpoint you get quite a few needs improvement, then it would be reasonable for you to contact us at the faculty to see if there's anything we can help you with or anything that you need to look at going forward from there. And talk about this with your preceptor. As mentioned before, the placement grade is given by the preceptor, but the course grade is given by the faculty. The assessments are posted in Core, and I really encourage you to look at what they are in advance so you know what the expectations are of you going in. And as mentioned, the preceptor will evaluate you on these outcomes at midpoint, and it will be the same exact outcomes that you will be assessed on at the final. You'll review this with your preceptor, and you need to acknowledge after you've reviewed it that you've done it with your preceptor, and vice versa. When you provide feedback to your preceptor, you need to do that in person, and the preceptor needs to acknowledge that you've done that with them in person, both at the midpoint and at the final. The midpoint assessment is considered to be formative. It lets you know where you're at and what things you need to work on. So if you get a number of exceeds expectations in one area, but some needs improvement in another, then that helps you to know what you really want to focus on the second half of your placement. And as mentioned, you need to do a self-assessment, so you should complete that before your midpoint and before the final so that you can take that with you when you have your review with the preceptor. So it's important to be honest with yourself to see how you feel, how you're doing. And as mentioned before, often you're kind of hard on yourself. So it's good discussion points with your preceptor. There are a few course evaluations that happen. There's a student course evaluation and it's anonymous and it's emailed to you. It doesn't come to you through Core. And there's questions on the course and how the course ran for you, etc. And that needs to be submitted within 48 hours of the course being finished. And then there's a post-course evaluation of the preceptor and site, and it's completed in Core and also submitted in with 48 hours of course completion. You don't discuss this one with your preceptor, and they can't see that one. And that gives you the opportunity to let us know if you want to talk to us about anything, good or bad, that happened in your placement. So in the syllabus, in the appendix, you'll be able to see which assignments need to be done. There are a number of activities, but there are 3 assignments that need to be completed. The first one is your learning plan. It's the same learning plan that's used in all placements, and it's very similar to the ACP Continuing Professional Development expectations that are expected of each one of us as practicing pharmacists. So there's two parts. You complete the skills inventory and then the learning plan. You post the first time at least 1 week prior to the start, review with your preceptor, refine and repost at the end of week 1. You post following your midpoint assessment, so if you receive any areas of needs improvement or not meeting expectations on your midpoint, you should address that in your learning plan and come up with some strategies on the things that you want to do and focus on so that you can be successful and meet expectations by the final. And then finally, you post it at the end of the placement. Just some housekeeping details when you post your learning plan. Include the date and the title in the document where you're posting in core, and include some placement information, and I'll let you take that off the slides. And this is what the learning plan part looks like. The second assignment is the care plan. So I would really like you to use the patient care process worksheet. I know you've seen it once in your therapeutics course. I hope to use it in your COPD section. Post one care plan using the patient care process worksheet, and it needs to have been reviewed by and approved by your preceptor before you post it to E-class. You must remove any patient identifiers and include the BPMH if you have one. There is a section, the first top section is to include other relevant data that's not in the BPMH, so that I as a reader know about your patient. Follow the patient care process again when you're providing information about your patient's data. Chief complaint, history of present illness, past medical history, etc., whatever is relevant. Make sure you state the DRPs properly, be clear and concise, use a statement. Make sure it's typewritten, 11-point font, double-spaced. The other thing I want to encourage you to do is do care plans on therapeutic topics that you have covered in first year. Even if you're doing an over-the-counter interaction with the patient, that still is patient care that you've provided, and you can do a patient care process or a patient care care plan on that patient. The second part of the care plan is a reflection. That's a survey that will be on E-class, and that's due on the last day of your placement. And the third assignment is the medication safety assignment. So there will be some articles for you to review through ACP website, the drug management modules, and I have provided a link for you for that in the syllabus. And you will need to create resolve a real or hypothetical medication error using ACP's drug incident patient safety report. So you will need to write up a drug error and again remove any patient identifiers, and you need to post that on E-class. You need to keep in mind that you will be using this assignment in your practice skills class in second year. So the rest of the slides in the package are just walking through some of the other activities that are in the manual. So I will leave it up to you to review this. You should be familiar with this and know what is your responsibilities to be doing in your placement. It's not your preceptor's responsibilities to engage you in these activities. It's up to you to know what you need to do and approach your preceptor and make arrangements to be able to accomplish all the things that have been set out for you in this course. So some take-home messages. Prepare, prepare, prepare. Take those first steps to become the pharmacist that you really want to be in practice. Be engaged. Your preceptors are really excited to have you, so I hope you're really excited for this experience. Be ready to apply your therapeutic knowledge. You've had some great courses this first year, and here's your opportunity to take what you've learned in the classroom and put it into practice. As mentioned before, no two placements are the same, and really take advantage of what your site offers. There is a link to the Student Success Services and resources if you think that would be helpful for you. Remember, there's travel and emergency funding through Student Services as well. And again, call the faculty if you have any concerns. The earlier, the better. The preceptors want you to succeed, but at the end of the day, it's your course. As Professor Guckert says, it's your ball game. Be a team player and just knock it out of the park.